Hi, it's Mary, a traditional Chinese medicine tutor and an acupuncturist in Canada.
Today's video explains the features and the indications of a wiry pulse and a tight pulse, and their differentiations are discussed.
By 10th degree, so-called 10th degree is observing the blood vessel itself. There's wiry pulse, tight pulse, and moderate pulse.
Wiry pulse.
A wiry pulse appears straight and long, hard and forceful, like the feeling of pressing on a wiring string.
The wiring string is long
and straight. In a regular situation, when you feel the 寸关尺,
there's 3 pulsations separately under your 3 fingers. However, for the wiry pulse, what you feel is not 3 dots, but a line, just like the wiry string or any kind of a wire. It's straight. You can feel the pulsation moves together. That's just exactly the feeling of touching on a wire. So you feel a line instead of feeling 3 pulsations underneath your finger eye. When you have chance to run into that type of patient, the patient has wiry pulse, you're not going to miss it because the feeling is exactly like you are palpating a wire, just like that. You're not going to miss that part at all.
A wiry pulse has 3 features. 1. The pulse shape is long and straight, and it feels like the 寸关 and the 尺 are linked by a string and moving up and down together. 2. The vessel is relatively hard when pressing it. 3. The pulse strength is relatively forceful.
A wiry pulse is associated with the liver, and it is the sign of 10th vessel qi.
A wiry pulse is closely related to disorders of the liver and the gallbladder, pain syndrome, and the syndrome of phlegm and retained fluid. The wiry pulse can sometimes be seen in patients with critical conditions with depleted stomach qi.
Disorders of liver and the gallbladder can cause the failure of the liver to govern the free flow of the qi. No matter what is the factor, it is pain or phlegm or retained fluid or pathological factors accumulated in the liver. As long as it blocks the flow of the liver qi, because the liver is in charge of the free flow of the qi. If there is a blockage of the vessel qi or the meridian qi,
the meridians and the tendons will tighten and contract, losing their gentleness and flexibility,
leading to the contracture of channels and vessels. Therefore, the pulse becomes wiry.
Liver and gallbladder disease is a general term used to describe diseases involving the liver and gallbladder. As a word element, the liver can involve other 脏 organs and has an excess, deficiency, heat, and cold nature. When the liver and the gallbladder have pathological changes, the pulse will have the wiry feature and other accompanying pulse features, such as a wiry thready pulse, a wiry rapid pulse, etc.
The liver and the gallbladder disease can also be divided into deficiency and the excess pattern as well. You can distinguish them by the pulse strength. If it's wiry and forceful, that must be the excess type of problem. If it's wiry and forceless, that's the deficient type of the problem.
For example, high blood pressure is a problem commonly seen clinically. If this high blood pressure is caused by exuberant liver fire or liver yang hyperactive, the pulse is usually wiry and forceful or wiry and rapid.
If the liver problem, like unsmooth flow of the liver qi, is caused by yin cold
contracts,
can lead to the unsmooth flow of the qi. The pulse is often wiry and tight. We know the tight is associated with cold. Together, the pulse is wiry and tight. If the liver qi is injured by yang, heat, the pulse is wiry and rapid. The liver qi is injured, you see the wiry. The injury is caused by yang heat. Heat associated with rapid, so you see the pulse is wiry and rapid. If it's caused by insufficient middle qi,
and the liver over controls the spleen with deficiency,
the pulse is wiry and moderate. The moderate here is talking about the speed of the pulse is not that fast. If the liver disease affects the kidney, which is the root of the prenatal foundation, the pulse will be wiry and thready because the kidney essence has been damaged. There's a deficiency. That's why you see the thready associated with deficiency. And also it's associated with pain.
We know that in TCM, there are two types of pain. The excess type caused by meridian obstruction and the deficiency type caused by poor nourishment of the meridians. In either type, as long as the cause of pain obstructs the meridian qi and makes the vessel qi tense, losing its gentleness and flexibility, a wiry pulse will present.
It can indicate phlegm and retained fluid as well. The phlegm and retained fluid can also make the vessel tense.
Phlegm and retained fluid are pathological products formed by the abnormal movement of water in the body. Once the phlegm and retained fluid are produced, they can move anywhere in the body following the flow of the meridian qi. If the meridian qi is blocked by the phlegm and retained fluid, as to the same mechanism of a wiry pulse caused by pain, vessel qi becomes tense and presents a wiry pulse. Generally speaking, according to the clinical findings, it is said that when the pathogen is the retained fluid, it is more likely to see a wiry pulse. If phlegm and dampness dominate, the pulse is more likely to be slippery. A wiry and slippery pulse is present if phlegm and retained fluid coexist. If the pulse is wiry, thready, rapid, and forceful,
felt like a knife blade, it means the absence of stomach qi and the disease is hard to cure. You are not feeling you are pressing on a violin string, but as though you are pressing on a knife blade. You know, knife blade, when you press on it, it's very sharp. If you go deeper, it even can cut you. If you had that kind of feeling, usually that suggests the stomach qi is absent and the prognosis of that disease is unfavorable. Then in the spring, you can see wiry pulse, and in aged people, you can see wiry pulse as well. The physiological wiry pulse is regular in spring when the pulse condition corresponds to the flourishing
of the spring qi. It is a little wiry,
but harmonious. For aged people, the blood becomes insufficient and the vessel condition gradually loses its harmony feature and becomes wiry, which belongs to physiological degeneration.
Tight pulse.
Tight pulse. It's tense and forceful, like a stretched and twisted cord. That's the metaphor in the ancient books to describe what the tight pulse look like.
A tight pulse has the following features. 1. The vessel wall is relatively stiff and tight. 2. The pulse force is tense and forceful, and it feels as though the pulse flicks the finger left and right. 3. The pulse condition is unstable and changing, as though you are palpating a tightly pulled rope. You put your fingers on a tightened rope.
It feels unstable. When you feel the pulse, the pulsation is unstable.
Sometimes left and sometimes right, as though the pulse location under the finger moves.
The wiry pulse is like the strings, violin string.
There is no twisting sensation.
When patient has wiry pulse, you directly feel there's a string, there's a wire underneath your finger. Your 3 fingers are touching the same string. It stays stable, but tight pulse is like a twisted cord. The position is unstable. On the other hand, even though the tight pulse and the wiry pulse are all tense, but tight pulse is more tense than the wiry pulse. It's very much stretched. Very strained one is the tight pulse. The wiry pulse, just like the wire, will not strain that much, stretch that much. Tight pulse suggests excess cold, suggests pain, and suggests the food retention. Among these 3, excess cold is understandable because cold can contract the vessel. When pathogenic cold attacks the body, yang qi is obstructed, and there is a conflict between pathogenic cold and the vital qi, leading to contracted vessels and a tight pulse. Pathogenic cold in the exterior often manifests itself as a floating and tight pulse. It's exterior problem, so it's supposed to be a floating pulse. And there's a cold, so you see a tight pulse. Put it together, floating and tight pulse suggests pathogenic cold in the exterior. If you see a deep and tight pulse suggests cold. Deep pulse suggests interior problem. Put it together, deep tight pulse will suggest pathogenic cold in the interior. A tight pulse due to sharp pain and the retention of undigested foodstuff are also characteristics of the confrontation between the pathogenic factors and the healthy qi.
Of course, the pathogen that leads to pain and food retention is mainly cold evil. This is in line with the first indication by excess cold. The exact mechanism will trigger the confrontation between the vital qi and the cold pathogen, and the vessel loses its gentleness and flexibility, thus becoming strained and forceful, and a tight pulse presents.
Comparison between wiry and tight pulse.
Here is the comparison between wiry pulse and tight pulse. Both wiry and tight pulses have the characteristics of strong and tense feature. They both are strong and tense. However, the tight pulse is tense like pressing on a tight rope, but the wiry pulse does not have that much tension feeling as the tight pulse. Comparatively speaking, the tight pulse
is more tense
than the wiry pulse. The tight pulse feels unstable,
and a wiry pulse has no instability feeling. When it comes to the indications, both indicate pain syndrome, but a wiry pulse is also seen in liver and gallbladder disease and phlegm and retained fluid disease. A tight pulse is seen in excess cold syndrome and food retention condition.
Wiry pulse usually associated with liver and gallbladder problem, and tight pulse associated with cold pathogen.
Hi, Mary. When a wiry pulse and a tight pulse can all indicate pain, what is the difference?
The major difference comes from the cause of the pain. The pain resulting in a tight pulse mainly comes from excess cold, which belongs to an excess type. The pain resulting in a wiry pulse is related to the unsmooth flow of the meridian qi, mainly involving the liver, which can be an excess or deficiency type.
If you find this video helpful, please give me a like, subscribe to it, and share it with others. See you in my next video. All the best!